welcome. I'm Karen McNew-McGuire with Carillion Clinic. We are here today to have a conversation about building trust when you're communicating with patients, particularly when it involves prescribing antibiotics. They're often overprescribed, especially for viruses, and they are not effective in those cases. I'm here with Dr. Schmidt-Dalton, who is the Associate Dean of Clinical Science at the Virginia Tech Carillion School of Medicine and also a family medicine physician. Thank you for joining us.
My pleasure. Thank you, Karen.
Yep. And then we have Dr. Pierce, who is the Interim Chair of Pediatrics at Carillion Children's, also joining us today. Two different perspectives and approaches for a variety of patients. So we're going to start with our first question. So thinking about a patient who comes in with a URI, who doesn't need an antibiotic, you know they don't need an antibiotic. How do you communicate effectively with a patient who demands it? No, I don't care. I want that antibiotic. What are some of the techniques you all use?
I think one of the first things is before you get to that point in the visit or the conversation is setting that visit up for success. And those are straightforward things like patient-centered interview skills. So just really being able to connect initially when you walk through the door with that individual. Simple things that many times we're distracted and maybe we forget to do. So eye contact, introductions, preferred names. Sitting down rather than standing up or over our patients also helps imply our interest in them as a person. It gives them a sense that we're listening, we're spending more time with them, and then asking open-ended questions and letting them share their story and giving them the space and the opportunity to do that so they feel heard and understood.
Anything you have to add, Dr. Pierce?
I think, summary, just active engagement, getting the patient, and I come from the world of pediatrics, so getting the patient, getting the family actively engaged. Often I'll come in, after I've done the exam, looked at the child, and you realize that they don't need an antibiotic. Just the good news, bad news I share is the good news is your child doesn't need this antibiotic. The bad news is they are sick. You're validating their concerns. The parent comes in because they have one patient, or the patient comes in because they're the patient. They don't look at your busy schedule, and it is respiratory season or whatnot. So really just making sure that they're on the page that you are concerned about the child or the patient, and the road to healing is really not that antibiotic.
Okay, some great perspective from both of you. Thank you. What are some questions you mentioned, Dr. Schmidt-Dalton, making sure they feel heard? So what are some of the questions you might ask your patient to help them feel heard and to let them know you're not missing something, that you are focused on them?
Yeah, so strategies of just summarizing back what you heard them say, making sure you've got all the details of their symptom story. That's our time to add in or clarify, do they have any, significantly alarming symptoms that we need to pay attention to? And potentially which of those symptoms is they're most concerned about so that we can be sure to address that in our plan. And so that they feel heard and the thing that is bothering them the most gets addressed towards the end of the visit.
And go ahead, Dr. Pierce.
Yeah, no, I'd add, sometimes you're going through the discussion, you're given the plan of action, and I'll look at the mom or the dad, and they just look, like, wow, I'm not sure. And, often I'll just ask, what are you worried about? Busy clinician, you sometimes forget to say, wow, this is great. Your kid doesn't have the ear infection. They don't have pneumonia. They may look at you and say, well, I'm worried they have pneumonia, and I didn't use that word. And, you can come back and say, no, they don't. They don't have that. This is very good that they don't have that.
And sometimes they share potentially past experiences. I'm concerned because in the past, so-and-so, this did progress, and symptoms like this progressed to that, and they had a bad outcome, or potentially, they were hospitalized, and I'm worried about having pneumonia. I'm worried about this. So being able to just name that and put that on the table and address it. And that also ties into our ability to make a good plan and follow up and some really clear instructions for them to be looking out for symptoms, so that they, if they develop those and they do begin to have some of those more concerning symptoms in the future, they have a game plan going forward.
One of the things I like to do at the end, as we're coming to a close, where I think it's at the end, is my favorite question is, does that make sense? You know, I'll talk about the care plan. Does that make
I like
sense?
that.
And if they look confused,
Yeah.
then we need to circle back. If they say absolutely, then I feel like, you know, hopefully that's a win, but and that they're happy on the road to recovery.
Okay. So now let's talk about some of the tools and strategies to help have these conversations, things that people sort of have at their disposal, so to speak, and that preparation is at the center of this, right?
So in adult medicine, I'm a family physician, and unlike many of our pediatric patients, many times the medical history, as you well know, is very extensive. And we take care of patients based on age that are at higher risk, based on their comorbidities. So being able to do a chart review, doing due diligence to know the person behind the door, so that when we go in, we have some familiarity with their risk factors, and they feel like we are addressing them as an individual.
And I wholeheartedly agree. Yeah, my chart review is a little bit shorter, but it says I care.
Yeah.
I care.
Yeah.
And what are some approaches to addressing the symptoms that are bothering people most?
I think it's helpful to ask them. Sometimes we make assumptions. They come with a list of symptoms, and we may have an assumption. Man, if I had all those symptoms and I felt like that would be the symptom that would impair my function the most. But that's not always the case. And so it's helpful to ask the patient which of all of these is most bothersome to you. If you could improve one aspect, what would improve your quality of life right now? And so I think that's helpful to ask them, and that we don't just assume.
You know, you may be looking at the whole constellation of symptoms, and it may be just that tickly ear because the congestion, or the eyes itching, or something like that. And some of these things can be so easy to kind of talk them through and get some relief.
The other thing, I think it's important to wait until we have gotten the interview, we've heard their story, we've done the physical exam, and we've really truly assessed, do they have concerning symptoms? So being able to summarize at the end those sort of more concerning alarm symptoms, and letting them know, I'm paying attention, these are the things I assessed. And given that, I'm really reassured at this point. I know you don't feel well, but I'm reassured that I believe this is a viral respiratory illness.
Another tool that I've used, and I've really tried to include other of my pediatric clinicians in, is we have here at Carillion, we have a symptom relief prescription. Because as you're closing with the patient, you may have them read back or talk back the symptoms, the plan of action you've got, but sometimes the visit seems busy. It's a rush day for them. Giving them a piece of paper and saying, hey, here's the symptom relief. This can make you feel better while you're waiting. Often that can be done in many formats, but I think handing them a little piece of paper that validates and goes over what's going to make them feel better.
I think those tools are also really helpful as a team. So as we work together as Carillion across different specialties and different offices, being able to use a tool across the entire system. And it, in some ways, lends credibility, a sort of validation for our own message. So patients are able to see that not necessarily as coming from one physician or one physician's opinion, but rather as an entire group. And I found that patients are very receptive to that. It's been helpful in that conversation.
One area we didn't touch on, and I'm just going to throw out as a discussion area, is the idea of what do the antibiotics do that we don't like.
Yes.
And it really depends on the level of understanding of the patient, the family, but oftentimes the antibiotics may have more deleterious effects, particularly if they have comorbid conditions. And I think bringing that up, and it's like, wow, I don't see a need for an antibiotic, and here's some of the other things the antibiotic does to your system. I think we're learning more and more about microbiome, the gut flora. I think what were the epigenetics and the impact of so many different factors. I think we really need to be stewards of what we're doing.
And then Dr. Pierce, you mentioned that patients may not always leave happy, but there are different degrees of
Absolutely.
emotions.
I think their past history and how they review what our advice is, maybe by foregoing antibiotics. But taking that time, you can have somebody who leaves really unhappy just because you were dismissive, or at least if you go back to that validating and engaging, they may leave unhappy because of their past history, but at least they're going to be closer to that step of understanding.
And many of our patients, it's hard for them to come to see us. Many of my patients have to navigate a city bus system. They may have to rely on Medicaid or other resources for transportation to my office. They may have to rely on neighbors or family members to drive them if they are not able to drive themselves. So the simple act of coming in to see us, we need to remember that this isn't easy for a lot of people. Coming in with that heart and that awareness of how hard it is helpful.
I'm sure our audience feels like you don't just do that once a day, right? It's not like you just have to get yourself psyched up once a day. It's like every single patient having to make sure that you're on for each one of them. How challenging is that for both of you in a busy day?
It can be very challenging, and being able to sort of practice and incorporate these different interviewing techniques helps them become sort of muscle memory. It helps them be your usual standard of care. So therefore, you don't have to think about it. And that's very helpful, particularly when we're stressed and we're tired and we're running late. It's just part of how we interact with everyone.
I think, so often in today's medicine era, with the world of change, the world of technology, what we're talking about here is best practices of antibiotic stewardship, and best practices are important. What many of these techniques we've touched on today are the art of medicine, how to be compassionate, how to engage, and recognize that you have a patient, not a process in front of you. I think the key takeaway is, on one hand, take the time to engage the patient and realize that with some of these tips, it's less time than you might think. It's probably less time than it would take for you to type up the antibiotic prescription. It's just how you engage that parent, how you engage that family, how you engage that patient. Thinking about the global impact of the multi-drug resistant bacteria that are out there and how fast they spread, how fast they can reproduce, and how fast that can close down a unit, I think we need to think about the future. You're going to take a little extra time now. I'm a pediatrician. I think of future generations. I've got children. I think of future generations. What legacy are we leaving for them if we don't take this on as a serious matter?
Thank you both so much for this useful information. I know it's going to be very helpful for providers throughout Southwest Virginia, hopefully improving those clinical outcomes and overall patient satisfaction. Thanks for joining us.